I am Dr. Shyam Srivastava. I'm Director Radiation Oncology at MGM Hospital, Washi, Navi Mumbai. Today I'll be talking about the cancer cervix, which used to be the most common cancer among the women, and fortunately over a period of time it has come down, the incidence has come down, and the cancer breast is higher than the cancer of the cervix. But obviously the problem still remains to treat these patients. When we talk about the treatment of cancer cervix, in early stage, very early when I am talking, the surgery or the radiation therapy have the equal result. So it is the choice of the patient. Especially the younger women, they prefer to have the surgery because they want to continue with the active sexual life. And the relatively elderly women, or also in the younger women, the radiation therapy is equally effective. When the disease is slightly advanced, then the surgery is not feasible in these cases, and the radiation therapy with or without the chemotherapy is the only choice. But today, when the disease is slightly advanced, the radiation therapy and chemotherapy are given together. We call it as a concurrent chemo-radiation therapy. So chemotherapy is given either weekly or once in 3 weeks, and the radiation therapy is given every day, and the total duration of treatment is something like 6 to 8 weeks in these cases. The radiotherapy is also two types, which is essential in these cases. So both have to be given. One, what we call as the external radiation therapy, which is given by the linear accelerator or some places with the telecobalt machines. And the brachytherapy is very important, where the radioactive source is kept very close to the tumor, near to the cervix or within the cervix and the vagina. So the external radiation takes around 5 weeks, and maybe another 2 or 3 or sometimes 4 times the brachytherapy is given. So total within 8 weeks of period, entire treatment will be over. There are a few side effects which can happen in these patients. One is basically with the external radiation, there may be diarrhea, maybe burning while passing urine, but these are very short-lived and the treatment is given and patient becomes all right. The long-term effects are very few in these cases, where something like some may perceive a kind of bleeding per rectum, bleeding through the rectum for a short period of time, which generally comes after 1.5 to 2 years of time, or maybe burning or maybe bleeding while passing urine. But these are again controllable. So therefore one should not worry about these things. They should come forward for examination to a doctor so that they can be treated very well. And once the treatment is over, they can go back to their normal life. So therefore one should not fear and consult the oncologist. Thank you very much.